Welcome back, everybody. So, today, what we're doing in this episode, we're going to go over facilities and populations. And go ahead and take a screenshot of this PDF. You can take a picture if you want. And so I'm going to go over this. This is something that I got from the California Association of Health Facilities. And what they did is they divided these facilities into three types: facility-based care, both facility and community-based care, and then home and community-based care. Now, they didn't cover all the facilities that I've encountered, so I'll do that after this uh, portion. Okay. So let me go ahead and get started with the first one. So, skilled nursing facility. Skilled nursing facility is probably by far the more common facility that we are familiar with, right, as RDHAPs. Skilled nursing facilities, they are amazing places. Okay. They are wonderful places for patients and residents to be there. Some of the names that we use for skilled nursing facilities are SNFs, SNFs, okay, SNF, SNFs. And then also some generic names are convalescent homes. A lot of people don't use that anymore, but then also probably the more popular one is nursing homes. So when we say nursing homes, it's a very generic name, but usually we are referring to in the RDHAP world as a skilled nursing facility. These facilities are either long-term care or short-term care, okay? But regardless of it, the patient, otherwise known as a resident, is receiving 24-hour care from a licensed nurse. Okay. Now, I do go over more in details about skilled nursing facilities. Right now, I won't go that deep into it, but I will say that I mentioned they have long term care and short term care. Okay. Think of long term care as you're not able to go back home anymore and you're there, okay? For whatever reason, complications or other things. But they also can include memory care, they can include hospice in the long term care. And then in the short term care, they have people that are coming in for 60 to 90 days. Sometimes it can be extended, but for the most part, that's what you will see: 60 to 90 days. Okay. Remember that, because this is why skilled nursing facilities are so sought after. Because in an SNF, the majority of them are Medicare and Medi-Cal. Okay, Medi-Cal is the Medicaid for California, and they're governed by Title 22. Okay, it's a federal law that states a lot of things, but one of the main things that it states with SNFs is that you have to have referral adjunct services like podiatry, optometry, all those things, not necessarily being on staff, but referrals, and that includes dentistry. Okay, it doesn't say that they need to refer to RDHAPs. Please make sure you understand that. Don't ever go to a nursing home and say, well, Title 22 says that you have to have an RDHAP. No, they don't, because RDHAPs are not federal mandated professionals. They are from the state of California only. So we don't have a law that says that. So in the SNFs, because they do have this law that says that the facilities have to have some sort of referral to dentistry, basically. That's how we can go in. Okay, and I talk about that more in details in another video, but just make sure you understand that is what a skilled nursing facility is. Okay. The next one, subacute care facility. Subacute care facilities are facilities that are essentially are skilled nursing facilities, but the patients have more medical conditions. They're a lot more compromised. They cannot survive 24 hours without some sort of assistance. And that can include tracheotomies, ventilators, and so on. Okay. Um, and so that is what a subacute care facility is. Now, those, I will tell you, those are great for RDHAPs because dentists usually will not go to these places. um, they still fall under Title 22, so they have to have some sort of referral system, right, for dentists or dentistry. But for RDHAPs, every single subacute facility in the state should have an RDHAP. And if you ever find one, you better get it. Okay. Why? Because think about it. They're G tube fed, right, with a tube down their stomach or abdomen, and they perhaps are on a ventilator, but they may not be on a ventilator for 24 hours a day, even if they were. Okay. The main way that you are able to go into subacute facilities, or the main reason why, it's not to make their teeth all nice and pretty and white. Okay. It's because of these three letters: VAP, ventilator associated pneumonia. You got to remember what that is: ventilator associated pneumonia. So it turns out that some of the same bacteria that we have with perio is the one that accumulates in the ventilator system of these locations. So I actually did this, okay? And I kept a log, and I would strongly urge you to do that. If you ever go to a facility that has never had an RDHAP, a subacute facility, keep a log of the patients that have had ventilator associated pneumonia. Most facilities, subacute facilities, are very good at avoiding this, but they always get one or two here and there. Okay. And so that's why RDHAPs are essential at every subacute facility. I was able to bring down in the facilities that I served by 50% VAP. So you put that on your marketing package. Okay, moving on. These are special treatment programs, and they call them institutes for mental health. Okay, essentially, what this is that they are, let's just call them mental institutions. Okay, I don't like that, institutes for mental health. These are, they're very diverse. They will have some that are um, open, they can come in and out. They're in a nursing home, perhaps in a wing, or they're a locked down facility, okay, that patients are there either voluntarily or not, sometimes court ordered. And these are patients that you will always need somebody there with you, okay? And schizophrenia, that is the big thing in these places. And I'm mainly referring to mental institutions, okay? Otherwise known as lockdown facilities. Now, because schizophrenia is a medical condition and they're giving out medication and there's nurses and there's medical doctors, these can be considered skilled nursing facilities for purposes of billing, okay? Including subacute care and then SNFs, obviously. So moving on. Now, these are CCRCs. They call them continuing care retirement communities. And so retirement communities, we think of usually retired communities as, homes that you could buy, I don't know, in Simi Valley and Valencia, Santa Clarita, and you have to be like 55 or over, and the houses are cheaper, right? I don't even know if they allow kids anymore, but I'm not talking about those retirement communities. This is a facility-based care retirement community. And so what this is they're big complexes, mega complexes of 3 levels of care: independent living, assisted living, and skilled nursing care, all in one campus. huge places. I'm talking about hundreds of people. Okay. And so think of it this way. Let's simplify it. You're 55 and no, let's just say 65. Okay. 65 and you sell your house and you want to go and be independent and you want to be around people your age. And so you live in an independent living community. Okay. So 65. And then suddenly, within 10 years, by the time you're 75, you need a little bit of help because you keep forgetting to take your medicine and you're getting a little depressed for whatever reason. And so now you're in the assisted living area of this CCRC. Okay. And then something happened. You fell and you broke your hip. Oh my goodness. So now let's say you're 70, 75. You don't have to be 70, 75 to break a hip. You could do that any age. But now you're in the skilled nursing care. Okay. And so you're recovering, hopefully, to go back to assisted living. Okay. Now, to be in the skilled nursing facility portion of the CCRC, your insurance will probably cover whatever it's going to cover. Okay. But in the independent and the assisted living, it doesn't cover. It does not cover. Your insurance will not cover this. This is where those reverse mortgages are, used for, or inheritance money or your pension or whatever. Everybody knows that when I'm old, put me in one of these places because these places are fun. Okay. Now, the other type of facility, which is kind of what I already mentioned, assisted living, but they can be freestanding. Okay. Now, assisted living isn't just an apartment complex where we're just going to brand the name assisted living. No, you have to have a certain license, and they're licensed as residential care facilities for the elderly. You can't just say, oh, I want older people living in this place. No, because there's certain things that they need to follow. Personal assistance, help with medication. They're not going to give you the medication, but they're going to keep an eye out for you. You can even request that you get your medication by going downstairs in the lobby instead of you taking it on your own. Or your family can request this. These places are amazing. I mean, I've been to some assisted living places. Oh my gosh, that they look like resorts. I was like, I want to be here. I want to live assistedly in one of these places. And so they are, fee based and they're not cheap. They're probably like $5,000 a month. So it's not something that just anybody could afford. So I wish I could afford these places when I'm that age. I know I won't be able to. My three boys will have to take care of me. A side note with assisted living, I'll come back to it. But one time, what I tried to do is we bought a van and we were like, okay, we're going to go to assisted living and just park outside and come on in, make a line to get your teeth cleaned. Had one patient, okay? Because once I was there, I realized they charge for everything. For $5,000, that doesn't include the transportation in the minivan to take the patients, I'm sorry, not the patients, the residents to the dentist. And how are you supposed to compete that? A patient's going to want to go back to their dentist, right? That they've been visiting for years. They charge them, okay? And so they weren't going to be able to, they weren't going to want to see us. So just a little side note on that. So moving on to what they call both facility and community-based care. And so these type of facilities are memory care and hospice. Now, memory care, as you would imagine, this is for dementia, Alzheimer's, patients that have cognitive conditions. Now, they can be memory care. The reason why they categorize this way is because memory care can be a wing in assisted living, in a boarding care, which we'll go over in a little bit, in even skilled nursing facilities. Okay. Now, not all of the patients that are in memory care need medication and so on, but because it's memory care, think about that. You're walking and then you're going to forget. And so they can get lost, unfortunately. They can just walk out. And so they wanted to make sure that there's a special category. And I don't know the details if they have a special license or whatever. I'm assuming they do. But if, let's say, a skilled nursing facility or a boarding care, they want to have a memory wing, they have to have certain, licenses and so on. So it's very, very important with memory care. And so those are facilities and those are patients that we are able to see. We're able to see all of these, by the way. So that's why I'm going over them. Hospice. Now, when you think of hospice, think of end of life care, right? So the terminally ill, either they are putting themselves in hospice or their families putting them in hospice. Now, you're asking yourself, because we all did at one point, why on earth would anybody want to get their teeth cleaned if they're going to pass away? Okay. And I asked that. I asked that many times with my hospice patients, and the answer was always, it's one of those things that you want to leave everything in order. You want to get your affairs in order. I want to pay off all my debts. I want to, you know, um, tell the people that I love how much you love them, and I want to get my teeth cleaned. I want to get my nails done. Whatever it is that they want to do, they want to do it. And so, how can you argue with that, right? And so, that is another that is another population and facility that we're able to see. Um, Something big with this is think about the ASA category, ASA 1 through, whatever, 4 or 5. Think about what that is. And so you would never see this type of patient, right, in a dental office. And so think about how unique our license, RDHAP, what kind of service are we providing? This is amazing. Hardly anybody can do this, okay, as an RDHAP. All right. So the other category that CAF, California Association of Health Facilities, gives us is the home and community based care. So the first type of facility or type of care, I rather just call it like that, is home health care. Now, home health care isn't a facility per se, and so it's essentially a service. Okay. And so home health care is, let's say you get discharged, all right, from a skilled nursing facility, but you're not 100% ready, right, or healthy. So they're going to send, let's say a physical therapist, a nurse, whatever. A lot of these things now, they can also be done with telemedicine. I know Kaiser does that a lot. And so home health care, they put this in this category, and this is something that, as RDHAPs, we are involved and we can be involved. So think of it in a couple of ways. Okay, um, a person is at home, they recovered, they had knee surgery, they're getting physical therapy or whatever. It gets complicated, and so now it's been a year, 2 years since they gotten their teeth cleaned. And so you're going to go in and you're going to clean their teeth. Okay. And now things get complicated. You can follow them to skilled nursing facilities and vice versa. It doesn't necessarily have to be one way. It could be the other way. So you're asking yourself, Aaron, how are we ever going to get contracts with skilled nursing facilities? This is how you're going to get contracts, by having a lot of home health care patients. Unfortunately, we all get sick and sicker or more sick afterwards. So then we follow them to the skilled nursing facilities. And so when you're there, you better have everything in order that way you can impress that social worker. Okay. So the other thing that I want you to think about with home health care is they have companies, right? uh First Angels Home Health Care, you've probably seen them around. And so these are services, right? That they send nurses and they send, so sign up with them. Whoever said that it can't be dental hygiene, it can't be RDHAP, right? I've had students that their spouses own home health care agencies. And so, you better get those referrals in there because we never ask about these things, right? An example would be person's going through cancer therapy, okay? And she's going through the recovery and she's going through radiation and chemo and all these things. And, oncologists and whoever never really discussed about dentistry. We all know this as RDHs, okay? But 2 years later, they're still, battling whatever condition they had. And so the home health care agency is going in there and doing the therapy and doing the services. Somebody needs to ask, you know, when was the last time you had your teeth cleaned? Because there's so much inflammation. That's not going to help anything, right? So we all know all this. C reactive proteins in the liver and so on. Well, anyways, that is home health care. Boarding cares are mini assisted living. That's exactly what they are. Okay. They don't necessarily need 24-hour nursing care because then that would be a skilled nursing facility. These are uh, licensed residential care facilities, okay, RCFEs, but they're smaller. So you'll see these in people's homes. So there's a lot of people that instead of buying a single family residence, let's just say 4 bedrooms, 3 bath. No, let's just make it easy. 3 bedrooms, 2 bathrooms. Think about how much the rent is. Okay, how much you can rent this out. It doesn't add up. If you buy the house for 700,000, 800,000, you can't rent it for $6,000. Nobody's going to afford that. You rent it for 3 to 4,000. So that's why you see so many boarding cares at single family residences because you'll make a lot more money um, renting it as a boarding care. Of course, these are licensed facilities. There's a whole thing that goes behind this. But us as RDHAPs, we are able to go see these places. Usually the owners will have multiple boarding cares and you'll have, somewhere between 4 to 6 beds in one home because they can put, 2 beds in one bedroom depending on the size. And so this is essentially their home. So these are like homebound patients, but a little bit more with medical conditions. And so these are great Medi-Cal covers as of June 15, 2026. But, things always change, and that's a whole other video that we adapt to. Okay, moving on. Home care. So home care is essentially a homebound patient, right? And so as of right now, remember, Medi-Cal can cover home care. Okay, they don't pay you extra. It's just like seeing a patient at a dental office, but it's home care. And so these are homebound patients, okay, and whatever conditions they have. And so you're able to see them. Okay. Some of them may have Medi-Cal, some of them may have other insurances, some of them will be cash. It just depends. Okay. But just assume that they do have medical conditions. Now, adult day healthcare, this you really want to be careful with because adult day healthcare, you are not able to go in and just set up your equipment and start seeing patients because, okay, um, it is not one of the areas that we're allowed to see. Now, you can get referrals or you can get a van and park outside, okay? These type of facilities are not designed for like what we need, right? Medical waste and so on. They usually will do chiropractic, physical therapy, occupational therapy. You don't bleed out from these things. Okay. So they don't live in this place, so you can't say it's homebound. This is just like a membership club. This is the country club, right? And so, in case you're not 100% what these are places that that are designed for people that either live at home, in a nursing home, assisted living, independent living, and they can go play bingo and socialize, do whatever, play dominoes. And so these are great for somebody, let's say they want to go outside and park in the van, because you could treat patients in a van, but you can't go inside and start treating patients. They're not licensed for that. So hopefully this is helpful. This is part one. I'm about to start part two, but I am going to zoom out so you can, in case you missed it, you can take a picture of this screenshot. And now the next page that I'm going to show you, I wrote it myself. It doesn't look as pretty as this. Okay, so you can go ahead and take a picture of this if you want. Take a screenshot. We're going to go over this. And so let me go ahead and zoom in. So these are what I consider other facilities, okay? And so let's talk about kids first. Now, with kids, and depends on the facility, we're usually talking about uh, under 18, okay? So with kids, there are subacute skilled nursing facilities, okay? And so not nursing homes, but skilled nursing facilities, subacute. So remember trach, G2, and so these are very difficult. These are difficult to work with. I think for the majority of people, some people can do this. And so that is definitely one type of facility that's out there. I will tell you, I always had a difficult time with this. I did have some facilities. There's not too many of these, okay? And you would think, oh, well, they'll just have kids in a just a regular subacute. No, they actually have specifically for kids. Unless somebody else has seen it out there, you can comment in this video in the comment section. But I've only seen that they would separate it where um, it was just for children. Okay, and then you had your adult subacute. Foster group homes, not to be confused with foster homes. Now, foster group homes, you want to you want to know the differences between level 11 and level 14. Okay, honestly, I don't know if there's a level 12, 13. This is the main levels, 11 and 14. Level 14 is what's considered a skilled nursing facility. Okay, so let me back up and explain it a little bit different. Foster group homes, think of them as what we used to call orphanages. Okay, it's a facility and it's not a house, it's an actual facility where it's kind of like a nursing home, but for kids. And a lot of these places, they have high schools inside. They have schools, the ones that are level 14, because the students cannot go outside. They are a risk to themselves and to society. Most of them have severe psychiatric conditions. Okay. And because, you know, you can read up on your medical uh, conditions, but usually schizophrenia is not something that you diagnose on 12-year-olds, 13-year-olds, right? And so all the signs are there, but because their brains are still changing and developing, usually that is not a diagnosis. So most of the diagnoses that you'll find in these places will be mood disorders, suicidal tendencies, mood disorders with schizophrenic, uh, you know, tendencies. And so, but they won't say schizophrenia. paranoia, stuff like that. Okay. Whether they were induced by drugs or just that's just how they were. So these facilities are not as common anymore, at least in LA County, because in LA County, they started shutting them down because a lot of issues, a lot of abuse that went on, and so I had a few facilities that were foster group homes and loved them. They were like the angels of the world. If that's actually what I based my master's thesis on. I loved it. Unfortunately, there's not too many. Level 11 are patients, kids that are not as severe. So think of it as less severe. And oh my God, with this, I can tell you stories after stories. And so this is definitely a place where you don't want to be alone in the room with a patient. There always needs to be a staff member. In fact, if you even have a camera, usually these places do, that's advisable because God forbid they say something, you have to go through the whole court system and everything. Very serious. But they're probably the most amazing human beings that you'll find. Foster group homes. Foster homes are different. Foster homes are what you would think of somebody, is adopting, let's just say, okay? A lot of them don't get adopted, but in somebody's house. So you could have kids on, that are your biological kids, and then you're also a foster parent. And so, or you could be a single couple and you're a foster parent. And so you'll get, one through whatever amount they allow you to. There's different licenses for that. The more medically compromised they are, the higher they pay. Let's say you only want to foster um, kids under the spectrum, right? And so they'll pay the foster parent a lot more for that. And the foster parents can go through either DCFS in LA County. DCFS is called Department of Children and Family Services, Department of Children and Family Services, or they can go through a family agency. Family agency is like a nonprofit. I can think of one that's called Bienvenidos, right? Means welcome in Spanish. And so that family agency works directly with DCFS, but the foster parents go through the family agency. So it's an intermediary. I can't ever say that word. So it's that you're like a subcontractor. And now, why am I telling you all of this? These are facilities that you can see patients. Now, yeah, you could go to their homes, okay? But there's so many. You could go to one here, one there, and they're kids, right? It's probably a prophy and so on, maybe sealants. But family agencies tend to have health fairs. They'll have family days. And those are the days that are great for you to meet everybody. And you can, meet all the different families. And they do these because they have to have doctor appointments, dental appointments within a certain amount of time. And guess what? RDHAPs can sign off that screening paper and they don't have to physically go to a dentist. I mean, obviously, we would recommend it, but we're able to sign that piece of paper. Okay. Let's see. What else should I tell you about foster homes and family agencies? These are great. So, not too many people, for whatever reason, like to work with these populations, but I've always seen one or two in every class that we have that they're very interested in this. And these, to me, these are like my angels. So if you ever want to reach out to me about this, I will tell you everything. Okay. Um, Another type of facility, if you want to call it, is WIC. Think about that. Women, infant, children. That is a nonprofit that we have in the state of California that helps subsidize kids and pregnant women in the state of California. And they do classes. So you can go in and teach oral care. They can get referrals. They usually work with mothers, which is where they get like their food, but they can also go to supermarkets and whatever. And so I'm not going to go into too much detail with WIC, but I will tell you that you have to be a nonprofit for you to be able to work with WIC. Okay? I'll let you figure that out. Okay, let's move on to adults. Drug rehab. Okay, drug rehab, unfortunately, we're still going through an epidemic with opioids, and so there is a big need for rehab facilities. So these facilities, um, I put drug rehab, but in reality, there's so many different types. There are for opioids. There are, and I don't like how they do this, but they consider it like if it's under a drug rehab for bulimia and anorexia. And so they're rehab centers. Now, some of them are cash, some of them are PPO based, some of them are Medi-Cal. And so, uh, the patients or the residents that live in these places, they're there for a good amount of time. And so, as you would imagine, an alcoholic, somebody that did meth, or even somebody that did anorexia, bulimia, they're gonna have a lot of teeth issues. And so, when was the last time you ever heard of a dentist that said, when I become a dentist, I'm going to go to drug rehabs and work with this population? I mean, you don't hear people say that. Even RDHAPs, we don't say this, but this is a big population that we have. And unfortunately, well, it's for their safety, obviously, and privacy. You don't see big signs that says drug rehab, and you don't really see too many commercials. And, I've seen them, but not too many. And so it's really hard to know where they're at. But with all the ways that you're going to learn on how to access these things, marketing and so on, you'll figure out where to find them. Okay, and even with just old-fashioned networking, and so you could go visit them, and as you're part of their recovery. And so that's what's so amazing about what we do, right? You're part of their recovery. You're not just there to make money. You're there to help our fellow humans. Okay, so homeless shelters. Homeless shelters, and this term, um, I think that within a few years, this we won't be saying this anymore. There's so many different terms that are out there now, and I've heard people say indigent. I don't think people use that anymore, but they do at facilities. So you need to know what that is, indigent. Okay, homeless, residence insecurity. There's different names out there. And so when you think of homeless shelters, I mean, obviously here in California, we have, such a homeless population, and they don't really know how many we have. And so, and it depends on your county and your city. Some cities, they push everybody to the big cities, and some counties push them to the bigger counties. And whatever it is that's going on, still a big population. Now, something I want to say about this is when you think of homeless shelters, think of it as two different types. When you are out there driving and you see people that are sleeping in a bus stop or whatever, that's not the type of homeless that I'm talking about. Okay, because the majority of those homeless are with mental, schizophrenic conditions, uh, drug-induced schizophrenic diagnosis. So those are not the ones that I'm talking about. Those I would be very, very careful with. Okay. Um, for many reasons. The ones that I'm talking about is where the majority, if you think about the 80s and the 90s and the 2000s, that population that I just mentioned used to live in what we call Skid Row, all those apartments that look abandoned, they're not abandoned. Those are actually homeless shelters. And so the mission, like let's say in downtown LA, that's just for food. And they do have a few beds, but there's a lot of beds in that area. And there's a lot of beds in a bunch of areas. Around my house, they just built one. And at first I was like, oh my God, what are they doing? But so because we have such a huge homeless issue that there's families that don't have schizophrenia and these conditions, they're the ones that are moving in to the homeless shelters because they can't afford the $4,000 rent and so on. So those people, families, single mothers, you know, um, even nuclear families, um, they're moving into the homeless shelters because in the homeless shelters, they have caseworkers, they have resources. You go in, you don't just go in to sleep, okay? You go in there to the homeless shelters and they help you apply for Medi-Cal, the public assistance, all these things. And they have referrals to dentists, physicians, there's kids, right? So kids automatically will get Medi-Cal. And so as an RDHAP, these are amazing places, right? You can treat, you can do so good, so much good in people's lives. You're going to be helping them, with their path of getting a home and a job and so on. And so the kids, they go to school. And so that's the type of homeless shelter that I'm referring to. Okay, I'm not talking about the people that sleep in the bus stops and so on. All right. Okay, so moving on, halfway houses. I call it halfway houses, but I know that there's other terms. Okay. But this is essentially after you get out of jail, prison, whatever you want to call it. Okay. And so these are drug and psychiatric rehab centers, but they're specifically for people that got out of jail, not to be confused with somebody that is doing a detox and they're going to go to a facility like a drug rehab center. That is more like a detox. Halfway houses are for people that are, they need peace. They don't want to go back, to their old ways. So they need somewhere else. I mean, think about what that means, right? I grew up in South Central LA. Thank goodness I never got into any shenanigans, any drama, right? But I had a bunch of friends uh, that got into stuff, right? A bunch of knuckleheads. And so, can you imagine? Okay, this is what you grew up with, and then you get out of jail and you go back to the same environment. Chances are, and I don't know the percentages, you're going to get back into whatever it is that you're going to get back into, right? Into that lifestyle, whether it's drugs or something else, right? And so that's what these halfway houses are for. And so this is another thing that they're not going to really advertise, okay? Now, I didn't include it, but I like to mention it in this part because going back to the kids with the foster kids, there are level 11 and sometimes even level 14, but it doesn't really matter the level. Let me go back up here. With foster homes and foster group homes and foster homes, with that population, when you turn 18, you are emancipated. You're an adult, right? And I'm sorry I'm going back, okay? You're an adult. But under California law, a foster child does not leave the system until they're 21. Okay. So they still get their Medi-Cal benefits and they get public assistance and they get, um, even to be able to live in places that are, for example, halfway houses. So instead of think of it as after jail is after leaving the foster system. Okay. We do a lot for this population in this state, and I love it, but not a lot of people in healthcare know about this. And so that's why I like to mention it when I mention the halfway houses. So, um, in case you ever go and try to market to these places, and you're like, oh, they're the formerly foster youth, then you understand why they have it. It's not that they were all in jail or anything like that. It's just, you went through the system and maybe you lived in a foster group home and even a foster home. And so now what? You're just going to get kicked out? What about if you don't have a family? So that's why they have these until you're 21 and sometimes even 26, but you don't probably need to know that much detail. Okay, so continue with adults, health fairs. Now, health fairs is like, come on, really? Health fairs? That's not a population. No, but that is definitely, if you think about it, that's a source of 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 patients, kind of like how if you go to one facility, you have many patients. So in health fairs, you put a booth, right? And you can get patients that way. And I'm not talking about putting a booth at the CDA at the dental convention. Don't ever do that, right? That's silly. I'm talking about at the Abilities Expo that I mentioned in episode 1, at fairs like that, right? There's a bunch of other ones out there. And so I'm sure all of you will be a lot more successful than I was, but essentially think of it as a vendor at the CDA. You're not going to just sit there and, oh my God, they're all coming after me and they all want to be my patients. No, they're just there and they see you and, it's like, what is going on? And think about when you walk the floor at the CDA, if you see one person at the booth and there's nobody else talking to them, you're like, oh, I don't want to be the only one. Like they're going to just talk and talk. I don't want to be put on the spot. But if you see a group of people, you're going to be right there with the chisme. It's like, oh, what's going on? What are they giving away? Right? I'm not telling you to give away stuff, but make it where you're going to have a crowd. Like, how are you going to get these people here, to get their attention? And this is where having somebody help you start signing people up. And it's like, do you want your teeth clean? Whatever, your spiel's going to be. But that's what health fairs are for. And education, obviously, right? Educate people about everything that we, in our field, in our profession. Okay. Um, ICFs, Intermediate Care Facility. Now, I put this completely separate. Okay, notice how it's completely separate. I didn't put it in adults, I put it in schools, because ICFs are very different, even though you would think SNF, ICF, no. Intermediate care facilities are usually for they're like boarding cares, right? 4 to 6 beds, and you'll see a lot of developmental and psychiatric issues. Okay, a lot of Down syndrome, chromosomal conditions in the spectrum, things like that. And so they're governed or they're overseen by regional centers. And in case you didn't know or don't remember from your program, there's 26 in the state, and and they're considered dental homes. And you have pretty much in every county one. Okay. Um, I like to show off and just Governor Ronald Reagan in 1969 was the one that signed this into law. Okay. Uh, and so regional centers will usually have RDHAPs as vendors. As you could imagine, as soon as somebody finds out about this and they try to go and sign up, how many RDHAPs we have in the state? They're all pretty much full, unless you live in, counties that they're very isolated. But still, you should try to sign up. Okay. Um, if you ever get referrals from them, That's great. Okay. They tend to stick to one or two RDHAPs, so it's a little bit difficult to get in. And they're probably doing voodoo with my picture right now. My friends that serve as regional centers. Aaron, don't tell people about this. But just going to ICFs is not the only way to get this population. You can also revert back to health fairs. That's where you're going to find them. So that's all I'm going to say about that. What I do want to mention is that the regional centers, okay, are considered dental homes. And most, I don't want to say most of them, but many of them are now hiring RDHAPs because they have learned to see the value in what we bring. And so you'll see the occasional, job listing that will say RDHAP for dental home, blah, blah, blah. And so what you would do in this case is you work for the regional center and they pay whatever they pay. I'm sure it's comparable to an RDH salary, but you're the one that's in charge of trying to find referrals, like for dental. Like, if somebody needs oral surgery or somebody needs their teeth cleaned or whatever, and preferably somebody that has Medi-Cal, that takes Medi-Cal. So I like to mention that because a lot of people don't know that you can work in those type of places. All right, schools. So when we think of schools, think of essentially what we did as RDHs, right, in public health, first graders. Okay, so the 6-year-old molars, as soon as they come out, right, we really have to get in there and do the sealants and so on. Okay, so with schools, unified school districts are not the only type of schools. Okay, think about that. There's also the archdiocese, right? Catholic schools, there's private schools, okay? And it doesn't necessarily only have to be first graders, it could be all of elementary, it could be, even other grades, but the majority is this, okay? Um, there is going to be a video that I will probably mix a lot of the schools with this on how to get in here. I have one word for you is nonprofit. Got to be a nonprofit. Okay. CCC means California Community College Health Centers. Okay. So California Community College Health Centers, what are you talking about? Well, when you're at a community college or any college, okay, that's what put them together. There's a health center, right? To what you pay with your tuition. And so, like at CSUN, they have a dental, they have a dentist, they have physical therapy, and it's all included and it's very inexpensive. They don't have an RDHAP. So, why is that? Right? I mean, this is perfect for RDHAPs. I mean, we can obviously work as RDHs, but do you see how, this is more like public health? This isn't, um, you know, uh, like elementary school type of populations. Others that I would like to mention is um, in a portable dental hygiene to companies. And so, what I mean by this is you can have, and remember the difference between portable and mobile. Mobile is a van, and portable is your equipment that you're carrying. Okay. So, portable equipment that you're carrying to go to businesses. You can go to businesses and set up, right? And, see patients. Now, I will mention to you that as an RDHAP, the essence of us seeing patients is for us to see the underserved population and medically compromised, right? Special populations. So this doesn't sound like, oh my God, they all have, high blood pressure? Is that how I'm able to see them? No, but because it is in the field that we work, I like to mention it because this is something that you could work with a DDS, right? But it goes to the heart of what we do, right? Providing to those that can't get out because they don't let them go out and days off to go to the dentist. But so that's another opportunity. Brick and mortar refers to a dental hygiene office in a designated area. Okay, a designated area is a place where it's been designated that there's not enough dentists to the amount of patients that have Medi-Cal recipients. So this is a video that I go over on how to designate. It's very easy. Okay, and how does that work? I go over it when we discuss brick and mortar offices. There's a lot you can say about brick and mortars. You know, it's not necessarily just my dental hygiene office, right? You could probably rent space at a brick and mortar. You could, have a partnership. You could work alongside a dentist. You can bring in independent practitioners, right? And so these are definitely one of the places that we can see patients. One thing that I do want to mention with brick and mortar is that because it needs to be in a designated area, you can see everybody. Okay. You can see anybody that is ASA1 with no health complications. All right. Because it's a designated area. And of course, I had forgotten, and federally qualified health centers. How could I forget? But federally qualified health centers are community health centers, like mini clinics or big clinics, hospitals that are designated because of their federally qualified health center designation. Okay. And so uh, I'm just going to throw out some names out there: Via Care, Altamed, Monsignor Romero. These are federally qualified health centers. And you can work as an RDHAP in these places, but also as an RDH. Okay, real quick, you could work as an RDH. And so, who's going to treat the people that can no longer come in because of their age or their medical condition? Me, I can do it as an RDHAP. You can get referrals. Aha. Okay, the last one before our time is up, our 60 minutes are up, and you got to probably get back to work. Mobile dental hygiene. And so, mobile, remember, it's different than portable. Mobile refers to a registered van. I know this is very broad, but we are able to own our own registered van through the Dental Hygiene Board of California, only one. And so this is something great that we could do. You could do so much with this, right? That you can go to different places. You could go to assisted living, park outside. You can go to somebody's house. You can go to different places. Something that's huge with this that I do want to mention is that with the registered mobile clinic, mobile van, is that I want you to think about it. Can I park in a public area that is not a designated city and see patients? This is my clinic. It's like my brick and mortar on wheels. So that is something you want to be really careful with. It should be either in a private property, and if it's in a public property, it needs to be a designated area. So hope you enjoyed my little facilities and populations. And don't forget, if you have any questions, please feel free to ask in the comments section, and like it, please. If you liked it. If you didn't like it, then tell me. Okay, and hope to see you at the next episode.